Welcome to the DC Perinatal Voices podcast, brought to you by the DC Perinatal Quality Collaborative, a new initiative where we spotlight the people, programs, and partnership across our hospitals and communities, all working together to improve maternal and infant health outcomes right here in the district. I'm your host, Yolette Gray, Senior Director, Maternal and Child Health Initiative over the DCPQC, and I'm thrilled to welcome you to our episode today. Today, we are honored to be joined by Dr. Tamika Auguste. Dr. Auguste wears many hats. She's the Physician Executive Director of the Women's Health Service line at MedStar Health, Chairwoman of Women's and Infant Services at MedStar Washington Hospital Center, and a professor of OBGYN at Georgetown University School of Medicine. She's a board-certified OBGYN with over 21 years of experience, and her work spans from patient safety, simulation, and medical education. She's also a former examiner for the American Board of Obstetrics and Gynecology, recently served on the ACOG Board of Directors, and is now the chairwoman of the ACOG Foundation Board. Dr. Auguste, thank you so much for joining us today. How are you doing?
Hi, thank you so much, Yolette. It's a pleasure to be here, and I'm looking forward to the podcast.
Awesome. We're so glad to have you with us. Let's jump right in. Can you share what inspired the creation of the Safe Babies, Safe Moms program, how it has evolved over time, and what makes it such a unique and an impactful part of maternal and infant care?
Well, of course, we are so proud of the Safe Babies, Safe Moms project at MedStar Health. And so, what inspired it, unfortunately, it's what we were seeing in the district, the disparities and the outcomes that we were seeing. We knew that this was not something that we could just watch, and we had to do something big. So, that's where the inspiration for Safe Babies, Safe Moms came from. We also were very, very fortunate to get a grant from a very large grant from the Clark Foundation. And this was where it all came together, where we decided to create an innovative program to improve maternal and infant health outcomes while addressing health disparities, particularly for Black birthing individuals and their families in Washington, D.C. So I think that what makes this program so special, it's that it is a comprehensive program. It's family-centered, and it's from pre-pregnancy all the way through early childhood up to age 3. The other critical part of this is our partnerships in the community. While we work here at MedStar, we are also creating a care continuum with our partners like Community of Hope, Georgetown University Health Justice Alliance, Georgetown University McCourt School of Public Policy. So again, bringing together all of these collaborators is really what makes Safe Babies, Safe Moms so special.
That is so great to hear, Dr. Auguste, and that really helps set the stage. Thank you for sharing that background. On a related note, behavioral health and social support are often left out of the conversation when it comes to perinatal care. How is Safe Baby, Safe Mom addressing these critical needs?
Your point is well taken. A lot of times when we think of prenatal care, we don't think of behavioral health and social support. But that is where Safe Baby, Safe Moms is different. In Safe Baby, Safe Moms and in the prenatal care that we deliver at MedStar Health, we have incorporated social support in services, what we may call wraparound services, but it is in response to looking at the social drivers of health. And so we want to make sure that for our patients that we have social workers that are able to help them, nurse navigators. These are the support services that we need. And we also would be remiss if we didn't acknowledge that behavioral health or mental health issues exist during pregnancy. So we partnered with our colleagues in psychiatry, and we really created a program where any of our pregnant patients are able to get mental health services through psychiatry, through our social workers, to start to address some of the needs. And it's not just the patients, but perhaps some of their family members as well. And we've been so successful with this and had such a high impact that this is how we deliver prenatal care now. We're going to have these social services, and mental health needs to be part of it. Not just the services we give, but we also need to screen and talk about some of the issues around mental health. So that has been incorporated into our prenatal.
Thank you for highlighting that. Such a powerful reminder of how comprehensive care really matters. Let's talk a bit more about impact. What changes or improvement have you seen so far in maternal and infant health outcomes because of this program?
So this is my favorite part to talk about. This program has been in existence for 5 years now, and we have some really great outcomes. What we have found is that patients who receive prenatal care through our program, they have 46% fewer cases of severe maternal morbidity among preeclampsia cases. The very low birth weight babies, we noticed 28% fewer of those being born and 24% fewer babies born preterm. So, and this is all compared to those who did not receive prenatal care through the program. We also noted that patients with Medicaid insurance have twice lower odds of having very low birth weight babies and twice lower odds of having preterm birth babies. And in addition to the clinical outcomes, we are closing the disparity gap. Black patients receiving prenatal care under this program experience 60% fewer very low birth weight babies, 53% fewer cases of severe maternal morbidity overall. I can go on, but these are some of the highlights of the great outcomes that we are seeing.
This is so encouraging to hear about the real world difference this program is making, Dr. Auguste. Thank you so much for sharing that. And as you talked about all the different collaboration and partnership, let's zoom out a bit. Here at DCPQC, we are all about advancing quality and equity in perinatal care across the district. How do the goals of safe babies, safe moms, align with the collaborative mission?
It's right there. Collaborative mission. I mean, Safe Babies, Safe Moms is so successful because of our collaborations that we have made. And so I think the encouragement of the DCPQC to collaborate across disciplines, across institutions is the crux here. I think that is what actually we will find that will make a difference. Being able to learn from one another and to share the resources that different disciplines or institutions may have in order for the bigger picture to improve the health of the pregnant individuals in the District of Columbia is the goal. So I think that is that collaborative nature. That is the foundation of what is going to make things better here in the District of Columbia for maternity patients.
Indeed, it's great to see that alignment in action. Now, looking at the bigger picture of collaboration, in your experience, how important is collaboration, especially across hospitals and organizations like DCPQC, when it comes to making real progress in maternal and infant health outcomes?
The role of collaboration here is learning from each other, highlighting what works well, and making sure that we don't repeat mistakes that may have been done in the past. So being collaborative as the DCPQC brings everyone together. We're learning from one another. I am learning what another hospital in the district has done well and how I may be able to apply that here at the hospital that I work at. I may learn also that an initiative didn't go well because of a particular reason. So, okay, now I know that's the reason. So let me not repeat that error. But also, when we all have successes, we share it and we all learn from each other's successes. And that just advances the mission, makes us a better city for delivering maternity care. So I think that collaborating across different hospitals, different organizations, it really just comes down to learning from one another and disseminating the best information so that we can take care of our patients in the best fashion here in the district.
I couldn't agree with you more. Collaboration really does move the needle in this work. And just to wrap up, on a personal note, if you could leave one message for the healthcare providers and families listening today, what would it be?
It's a great question. So I think that the message I would leave for our families, our patients and families was please talk to your healthcare provider. Tell them your fears, tell them your concerns. Engage in a conversation. put everything out there. So there's nothing that you wish you would have said and never got the chance to say. I think that is the way that we really bond and work together to deliver you the best maternity care that we possibly can give. For our healthcare providers, my message to them, listen to our patients. They are telling us in various ways how we can help them, what is their pain point, or what are their barriers to getting excellent prenatal care. So take the time, slow down, listen to them. They will show us, tell us what we need to do to help them have a wonderful and healthy experience in maternity care.
Beautifully said. A powerful note to end on. Thank you so much, Dr. Auguste, for sharing your time, your expertise, and your passion for maternal and infant health. Your work is truly making a difference in our community. And thank you to everyone tuning in for episode 2 of DC Perinatal Voices. We're just getting started, and we hope you'll keep listening as we continue to highlight the amazing people and programs working to make birth safer and more equitable across the district. To learn more about the DCPQC, visit us at dcpqc.org and be sure to follow us on Instagram, Facebook, and LinkedIn. Until next time, stay well and stay connected.